Most of you who have rheumatoid arthritis, you might be having this increased symptoms. We call that flares. Many of you might think that flare is due to something you did wrong. You might have eaten something unusual, or you might have overdone with your joints. But the fact is, rheumatoid arthritis flare are unpredictable. They may not be under your control. Today, we'll walk you through few important things about rheumatoid arthritis flares. The first one, what is a flare? Then let's understand about what are those triggers, how do we manage those flares, and then what we can do now so that you don't have any of those flares in the future. Stick around. Hi Rheumatoid Arthritis Warrior, this is Dr. Ananta Subedi, your rheumatoid arthritis coach at the Room Doc, as well as a practicing rheumatologist at Empower Arthritis and Rheumatology Center here in Cary, North Carolina. Before I go deeper, don't forget to accept my gift on this holiday season. We have this free rheumatoid arthritis guidebook just for you, as well as I have prepared a special smoothie recipe to fight against rheumatoid arthritis and those flares. Please accept those in the description below. And we also have an important mission for 2026. We want to reach at least 100,000 rheumatoid arthritis warrior through our channel so that we can help them feel better and empowered. And you can support us in this mission by liking our videos, sharing with other people who are suffering from rheumatoid arthritis. Please help us reach that goal. Let's go dive deeper into rheumatoid arthritis flares. And the first question you might have is, what is a rheumatoid arthritis flare? Now, many of you, when you were diagnosed with rheumatoid arthritis, you might have joint pain. Because of joint pain and other signs of inflammation, your doctor might have diagnosed you with rheumatoid arthritis. Now, during a flare, what happens is your pain level goes significantly higher. So, increased pain than usual is one of the first clue of rheumatoid arthritis flare. And here are the other symptoms. The next one being the stiffness. In particular, when you wake up in the morning, you feel much more stiff in your joints. Typically, in rheumatoid arthritis, you feel more than 30 minutes to an hour of stiffness. And during those flares, it can be even longer. And the reason we typically feel stiffness is those joint fluid. It feels like you are not able to move those fluid in your mornings. So the next common symptom is the swelling. Swelling is a hallmark of inflammation. So if you recall, when your doctor made your initial diagnosis of rheumatoid arthritis, they usually feel your joints to look for clues of inflammation. And swelling is one of the most important clues of joint inflammation. And during a flare, that swelling becomes significantly more than usual. So the other symptom is fatigue. As we have recently discussed in our previous video, fatigue is a major problem in rheumatoid arthritis. And one of the main reasons for fatigue is uncontrolled inflammation. And when you have a flare, there is a significantly higher level of inflammation. And that inflammation causes worsening fatigue. That is not just your regular fatigue, but much more worsening fatigue compared to your baseline. Now, the last symptoms I described here is fever. So low-grade fever could also be a clue of rheumatoid arthritis flare. Now, that is due to the inflammation happening in your body. But typically, RA flare typically cause low-grade fevers. If the fever is significantly higher, we need to worry about other things, including infection, because sometimes infection can mimic like a rheumatoid arthritis flare. But it's very important to understand whether this is RA flare versus infection, because the treatment is very different. So if you have very high-grade fever, it's a red flag sign that it could be a sign of infection, not just a flare of RA. Now, as we talk about rheumatoid arthritis flare, the other important topic we really need to understand is what are the triggers of rheumatoid arthritis flares. And I have listed here some of the most important triggers of rheumatoid arthritis flares. The first one being stress. When you are stressed, your body makes extra cortisol, and then that can lead to an increased level of inflammation. Hence, you might feel that when you are stressed, if there is something going on in your life or in your work, that can trigger a rheumatoid arthritis flare. So the second flare is overexertion. So you need to listen to your body. When you overdo it, sometimes that can also cause worsening pain and a rheumatoid arthritis flare. Hence, you need to pace yourself, not overdoing, so that you can minimize the future flares. Now, the other is infection. When you have an infection, your body is trying to fight against that bacteria or the viruses. when your immune system is hyperactive, it can also lead to rheumatoid arthritis flare. Hence, if you have any type of infection, just stay alert if in case you might get rheumatoid arthritis flares. Now let's go to the next thing that could cause your flare, and that includes your medication changes. So if you have rheumatoid arthritis, you might be on different type of medication. It could be a DMARD like methotrexate, sulfasalazine, or other biologics. If in case for any reason you are not able to take your medication, if you have missed your medication doses, that is another important clue or important trigger for rheumatoid arthritis flare. Hence, it's very important to be regular with your medication so that you can minimize these type of flares. Now, sometimes you might have trauma due to different reasons like surgery or other unexpected trauma that can also be one of the trigger for rheumatoid arthritis flare. Now, the last is I mentioned about lack of sleep. Sleep is very important for our body. It's a time where your body gets rest. But if you are not able to get good sleep for a different reason, it can be also a trigger of rheumatoid arthritis flares. Hence, always prioritize your sleep to minimize such type of flares. Now, we learned about what is a rheumatoid arthritis flare, what are the triggers. Now, the next important topic is how to handle a flare, or how do we manage those flares. And I have used this pyramid to help you understand what you can do to handle those flares and how to manage those flares. Now, I have divided those into 3 different buckets. The topmost part is I highlighted in red because this is very, very important. Now, when you have any of those symptoms, like you have severe pain, you have unexplained high-grade fevers, and if you suspect you have an infection due to any symptoms you are having, or if your symptom is very uncontrolled, you are in such so severe pain that you cannot manage your pain, those are the signals that you need to immediately call your rheumatologist. Now, if in case you are not able to keep in touch with your rheumatologist, you should even go to the urgent care or the ER. Now, let me explain you why this is important. If you have severe pain, you cannot manage those symptoms at home. You may not have all the tools that you need to manage this degree of pain. Now, the next important, fever. So as I mentioned earlier, fever could be an early sign of a rheumatoid arthritis flare if it is a low-grade fever. But if you have high-grade fever, that means there might be an underlying infection. For example, you might be having pneumonia, you might be having urinary tract infection, or sometimes rheumatoid arthritis patients are also at risk of joint infection. When that happens, you typically have severe pain in 1 or 2 joints. If that's the case, it becomes a medical emergency. Hence, if you have this unexplained high-grade fever, it's very important to inform your rheumatologist sooner the better. And if you don't hear from them, please go to the ER so that they can re-evaluate if in case there's an infection and they can adequately treat you. Now, the next tool that you have in managing your flare, if you have a milder symptoms, and you can manage your symptoms with non-steroidal anti-inflammatory. Now, there are so many different varieties of non-steroidal anti-inflammatory. These are basically milder anti-inflammatory medication which are typically used and helpful for milder flares. But there are some precautions. If you are known to have kidney problem, if you are known to have high blood pressure or liver issues, you need to be careful. You need to consult with your doctors whether the non-steroidal anti-inflammatory are safe for you or not. Because these medication can affect your kidneys, they can affect your liver, they can increase your blood pressure. So always consult with your doctor whether it is safe for you to take those medications. Now, when you go to your doctor next time, when you go to your rheumatologist on your next visit, please ask them, can you take non-steroidal if you have another flare? That can help you guide whether it's safe for you to take NSAID on your next flare. Now, the next medication that you can take to manage your mild flare is Tylenol. It is also called acetaminophen. Depending on which part of the world you are in, there are different names or different versions of this medication. This is basically a mild pain medication. It is not an anti-inflammatory, so it's not as effective as NSAID, but could be helpful if you have milder degree of pain. Now, Tylenol, you can take it in different forms that help you manage your mild pain. Now, there are other medication that you need to take based on the recommendation from your rheumatologist. That includes rescue steroid or rescue corticosteroids, which are more stronger medication compared to the other two. Now, the rescue corticosteroid typically help calm down the pain. So when you go see your rheumatologist next time, you can ask them if you can get some rescue steroid in case of you have a flare. But be cautious. Overuse of steroid can cause significant side effects such as high blood pressure, diabetes, and many other side effects. Hence, you will need to always consult with your rheumatologist if you want to take steroids. And other one is you need to adjust your DMARDs. And what does that mean? If you are having multiple flares, in a couple of months, that means that your rheumatoid arthritis is not adequately controlled and which deserve special attention from your rheumatologist. So if you have multiple flares, go talk with your rheumatologist. Ask them, do you need to adjust your DMARD? It could be your regular DMARD like methotrexate, or it could be biologics. And adjusting those medication can help prevent your future flare attack. Now I'm going to the base of our pyramid, and I put in the base because this is so important on your day-to-day life. If you follow these steps, we can minimize these flares, and that includes self-care strategies. And most of the things are very important for your day-to-day rheumatoid arthritis management, and most of the things you can do at home. And that includes adequate rest and also bracing. Like if you have a RA flare, it does deserve a resting time. If you are working, you might need to take a time off from your work. Hence, rest is so important to manage rheumatoid arthritis flares. Now, as I mentioned earlier, during a rheumatoid arthritis flare, you might have a lot of stiffness in your joints. And if you have a lot of stiff joints, heat could be helpful to mobilize your joints. But on the other side, if your hands are very hot to touch, then cold pack might be helpful to decrease the pain and inflammation. So you can use either heat for stiffness and cool for inflamed joints. So the other one is gentle movement. When you're having a flare, you might be having a lot of pain, so you may not be able to do a lot of exercise. Hence, you need to rest your body, but too much rest can cause stiffness. So to counter that stiffness, gentle movement could help you mobilize your joints. It can also help you minimize the inflammation. Hence, gentle movement is important part of managing a rheumatoid arthritis flare. And the last is stress management. If you could recall, when I talked in the beginning, what are those triggers? Stress is one of the major trigger for rheumatoid arthritis flare. So we need to understand how do we manage those stressful situations. Now let me quickly recap our pyramid. So on the top is those red flag signs where you need to immediately call your rheumatologist, or even you need to go to the ER when you have high-grade fever, when your symptoms are severe. And in the middle of the pyramid, you have those basic medication that you can take to manage your pain if it is mild before you head to your rheumatologist's office. And that includes some of the non-steroidal anti-inflammatory. But the caution here is check with your doctor before you go on those medications to make sure your kidneys are healthy, your liver is healthy, and you don't have high blood pressure. Now the Tylenol is a reasonably safe option to do, and comes the rescue steroid, which you need to consult with your rheumatologist whether it's safe for you to take those corticosteroids. And other important, adjust your disease modifying anti-rheumatic drug so that you don't have those recurrent flares. And the bottom of the pyramid, the base, is very important. These are all the self-care strategies that you need to do to manage your RA effectively. Now all of you RA warriors, thank you so much for watching today, and I hope it helped you make some plan for your next RA flare, and hopefully you have some toolkit ready for you so that you don't have to be scared for the next flare. Now before I depart, please don't forget to accept our gift, the Rheumatoid Arthritis book, free for you, and the RA smoothie that will help you fight against rheumatoid arthritis as well as those flares, and support us in our mission, the mission of getting up to 100,000 RA warriors to help them fight against rheumatoid arthritis. And I'll see you in the next video. Bye bye.